Welcome to the Fitness Pain-Free Show, where I help physical therapists learn how to get their clients out of pain and back to training in the gym. My name is Dan Pope, and I'll be your instructor. I'm a physical therapist, coach, and fellow meathead. I love training just as much as you do and want to help you get all of your patients out of pain and back to the gym where they belong. Hello and welcome to another episode of the Fitness Pain-Free Show. Today we're going over how dangerous is CrossFit really. So first and foremost, thank you so much for your support. You allow me to do what I love for a living. My name is Dan Pope. I'm a physical therapist, coach, personal trainer, and meathead. I love fitness. I love lifting weights. This is the Fitness Pain-Free Show where we help coaches and physical therapists like you get your patients out of pain and back to training. If you are watching this on YouTube, please hit that like button, comment, and subscribe to the channel. If you're listening to the podcast, please give a 5-star review. It's much appreciated. So, if you want to go that extra mile and support the channel even further, please consider subscribing to my premium membership, Fitness Pain-Free Insiders. It's a comprehensive educational resource and toolkit for the fitness and rehab professional. So think Netflix, but for trainers and physical therapists. It's premium content from yours truly. I make all the content on there, and it's similar content to the show, but way more in depth. It's updated monthly. I've been updating this thing for the past 5 or so years, and there's a lot on there. There's 100 plus webinars, ebooks, and complete guides. You also have access to a private Facebook group to have all of your questions answered by me. You also get a chance to decide upcoming podcast topics. So if there's something you really want to learn more about, hear me go in depth about, let me know. I can do that. And you can get started for just $1 for a week-long trial. And after that, it's a recurring membership of $9.99. All right. You can cancel anytime. All right. I won't be upset if you do. And if you want to get started, all you need to do is head to fitnesspainfree.com, click on the programs link, and then click on the Fitness Pain-Free Insiders online library and get started. So first and foremost, I just want you to let you know that I coached CrossFit for about 6 years or so, and I competed in CrossFit for about 7 or 8 years. I really like CrossFit. I have been working with CrossFit athletes for about a decade or so. So it's near and dear to my heart. I'm not trying to talk a bunch of crap on CrossFit and say how bad or how dangerous it is, but I also want to make sure that I'm not being biased and telling you that it is awesome and you should definitely try it when in fact there is some risk, okay? So I'll try to be as unbiased as possible and try to dive through some of this research. I want to give you an evidence-based opinion on CrossFit and the risk of injury based on what we're seeing in the research world. And I got to tell you, it's a little bit complex, but we'll go over that. First and foremost, it's important to understand how injuries are reported in medical literature. What you'll typically see is something along the lines of blank injuries per 1,000 hours of participation, right? And in a bunch of these studies, the number that pops up is around the number 3, right? So let's say the reported incidence of injuries in CrossFit participation is 3 injuries per 1,000 hours of participation. Now you have to do a little bit of math to figure out how many injuries that is in a given year. Let's say I train 5 times per week for 1 hour, right? That means I'm doing roughly 260 hours of training per year. That means it takes around 4 years to train for 1,000 hours. So over the course of those 1,000 hours, if you're injured 3 times in that 4-year period, you've got about 0.775 injuries per year. So less than 1 injury per year, okay? So what defines an injury? Now, this is also really challenging to try to compare CrossFit study from CrossFit study as well as CrossFit study to, let's say, football injury study, right? So one, you'll see time loss versus non-time loss injuries. And this is more common in the sports world. So basically, they have injuries that force you to stop practicing or stop competing, right? Non-time loss injuries are injuries where, yeah, the area hurts, but it's not stopping you from training, right? It's not stopping you from competing. The other thing you'll see commonly are surveys or questionnaires grading the severity of an injury, right? So there's like overuse injury questionnaires. And they'll also ask questions like, do you have to have a surgery because of your injury, right? So that's one of the ways that they try to create these injury definitions. And the other thing is that, based on the sport, or the culture, I guess, there are sometimes established norms of what constitutes an injury from prior research. So if you're the first person to do a few studies about risk of injury in, let's say, CrossFit, you may start a trend where other studies in the future start utilizing that same definition of an injury. And this one's actually pretty common in some literature that we're going to go over today. And that's any sensation, pain, or injury during CrossFit training that resulted in one or more of the following outcomes. And that could be a complete withdrawal from CrossFit training or other routine physical activity for a period longer than 1 week. That could be modification of normal training activity in duration, intensity, or modality for a period longer than 2 weeks, or any physical complaint severe enough to make the practitioner seek medical help. So again, a lot of definitions of injury, which is going to make things challenging to figure out how dangerous CrossFit really is. So first, we're going to go over a bunch of studies, right? And then we're going to try to come up with an idea of just how dangerous CrossFit is, right? This first study was CrossFit, Injury Prevalence and Main Risk Factors. This had 414 participants, all in Sao Paulo, Brazil, and they were all affiliate or members at CrossFit affiliates. And they were 16 of age or older, and they had to have 6 months or more months of CrossFit practice. They're tracked over a 12-month period, and they found 157 injuries, which if you do the math, that's 37.9% of people got hurt over that year period. So what definition did they utilize? Well, they used that definition that we just talked about, right? I don't want to repeat it all over again, but it's any sensation, pain, or injury during CrossFit training that resulted in one or more of the following outcomes: withdrawal from CrossFit, modification, or going to see a healthcare provider, right? And this is a definition that is consistent with other studies as well. So they found in this study that there was 3.24 injuries per 1,000 hours of participation. Like we did the math previously, that's around 0.75 injuries per year of participation if you're the person that trains 5 times a week for 60 minutes. If you train less than that, then you'll probably end up having fewer injuries per year. And if you end up training more than that, you'll probably have a couple more injuries, right? What kind of injuries were they having? Well, they were mostly called strain or overload injuries. I'm not exactly sure what an overload injury is, but imagine it's too much weight, too much exercise. I'm not even sure what that means, to be honest with you, but that's what they reported it as. And the places that were most common to have an injury were the shoulder, followed by the low back, the leg, the wrist, and then the knee. And you'll see this. This is a trend that kind of continues in other studies. The shoulder, the low back, and the knee are probably the most common injured areas. The next study we looked at is entitled, Are Injuries More Common with CrossFit Training Than Other Forms of Exercise? And I gotta be honest, I've seen this study floating around a lot in the social media world, and I was like, okay, this seems really relevant. I should read this and try to get some good information from that. And I gotta be honest with you, it's probably not the best study, right? And we'll talk about this in a little bit, but they had a couple different injury definitions because they're looking at 3 different studies. The first one was Wiesenthal et al., and this is the same exact definition that we had from the prior study, right? Musculoskeletal pain, feeling, or injury as a result of CrossFit workout that led to at least one of the following situations, and that's total removal from CrossFit or other physical activity for greater than a week, modification of normal training, duration, intensity, or mode for greater than 2 weeks, or physical complaint severe enough to require a visit to a healthcare professional, right? Now, the other folks, there was a study by Greer et al., and this is where things get a little cloudy because they define an injury. Injuries range from overuse injuries, traumatic injuries, and overall injury, and it seemed a little bit weird how they actually classify what an injury was, but they utilize ICD-9 codes. So if I had, let's say, shin splints, right, or patellofemoral pain, they utilize those codes to figure out whether or not you had an injury, okay, which is going to be very different than the prior definition. Then Hack et al. Proposed that injury was anything that prevented the individual from training, right? So I was almost going to throw this study out just because I don't feel like it gives us great information, but it goes to show you that there's a huge variance in what is considered an injury. And then if you look at a review article like this, it's looking at 3 different studies with all different definitions. You're probably going to get a bunch of junk results, right? So what do they find? In the Wiesenthal et al. Study, 19.4% of people sustained an injury over 6 months. They didn't even report a number of injuries per 1,000 hours of training, right? The Greer et al. Study was an extreme conditioning program that was like CrossFit, all right? So it wasn't even CrossFit training or at a CrossFit affiliate, right? And when they're looking at injury rates, they only compared that with traditional Army training, which doesn't really help us very much, right? So again, this study's probably not the best one to determine whether or not CrossFit's safe for you. And the Hack It All study was the only study that actually gave you a rate of injury per 1,000 hours of training, and they found 3.1 injuries per 1,000 hours of training. Okay, now for the most common injured areas, the Weisenthal et al. Study found the shoulder, low back, and the knee was most common. The Greer et al. Study, I couldn't find any reported areas of injury, and the Hack et al. Study showed the shoulder and the spine were the most injured areas. Next study I want to look at was a huge one, okay? And again, I almost threw this study out too, but I just wanted to show you how much variety there is in research out there and how gray and clouded it gets when trying to figure out the injury risk, right? So this was called the Injury in CrossFit, a systematic review of epidemiology and risk factors. And they looked at 25 total studies and 12,000 CrossFitters. And you might look at that and say, oh my gosh, that's great. They've got a whole bunch of different participants. We're probably going to get some great data from this, right? But what ends up happening when you have so many studies and you don't have strict exclusion criteria is you get a really large injury rate, right? Because there's a big difference in the populations, a big difference in what people are doing in the gym, so on and so forth. What the injury rate they found was that there's 0.2 to 18.9 injuries per 1,000 hours of training. So you could look, I mean, that could be somewhere between one injury every 10 years, right? And an injury per month, right? It doesn't really give us a whole lot of great information, okay? But they also did find that the areas that are most injured were the shoulder, the spine, and the knee, right? Now, this next study, also very interesting. It was called a 4-year analysis of the incidence of injuries among CrossFit trained participants. And what they showed was 30.5% of their participants reported an injury over 12 months. That Weisenthal study showed 19% injuries over 6 months. So it's actually kind of similar in terms of the amount of injuries reported over a 12-month period. And the injuries that they reported most commonly were shoulders at 39%, back at 36%, knees at 15%, elbows at 12%, and wrists at 11%. And the injury rate, and this is super interesting, was very, very low at 0.27 injuries per 1,000 hours. Now, keep in mind, if you have 3 injuries per 1,000 hours and you train 5 days a week, that's around 0.75 injuries per year. So a little less than an injury per year. This is far, far less than that. You'd probably have to work out 10 years or so to see an injury, right? So very, very low injury rate. And here's the other thing. They utilize the same injury definition as the Weisenthal study, which is any muscle, tendon, bone, joint, or ligament injury sustained while doing CrossFit that resulted in your consultation with a physician or healthcare provider and caused you to stop or reduce your usual physical activity, your typical participation in CrossFit, or caused you to have surgery. And what's funny is I went back and read the original Weisenthal study, and the definition is actually a little different than that. So again, it's a little bit confusing. So what you will see is that, CrossFit populations that look on paper to be pretty similar and the risk of injuries are very, very different, okay? So again, hard to kind of quantify how risky CrossFit really is. So just how dangerous is CrossFit in comparison to similar sports? So across most of these studies, the rates of injury in CrossFit are similar to Olympic weightlifting. Several studies kind of showed this. Some studies actually show that weightlifting was safer. Artistic gymnastics, okay, powerlifting, distance running, and track and field. All right. Now, I found this chart in one of the research studies that I thought was great, and it was the injury rate in comparison to other sports. And I'll just read these out for you. But if you're looking at swimming, you have an average of 1 injury per 1,000 hours of participation. And all of these numbers are going to be per 1,000 hours of participation. So for swimming, that's 1, right? Which is quite a bit lower than that 3-ish number we've been talking about in prior studies. Walking has 1.2. Apparently swimming is safer than walking. Cycling is 2. CrossFit, at least in this chart here, is somewhere between 2.4 and 3.1, which is kind of similar to what we saw in previous studies. Triathlon in preseason is 2.5. Running, long distance running, is 2.5. Elite weightlifting is 2.6 to 3.3, which is kind of interesting. You compete at the highest level of weightlifting, and it's going to be as safe as something like CrossFit. Regular gym training is 3.1. Gymnastics, 3.1. Running overall, so I'm guessing this is going to be a variety of different types of running, long distance and maybe short sprints, I'm not sure. 3.6. Triathlon in the competitive season was 4.6. Tennis, 4.7. Women's soccer practice, 5.2. Soccer, 7.8. Basketball, 9.1. And men's spring football practice, 9.6. So you can kind of see, generally speaking, fitness activities are relatively safe in comparison to field and court sports like basketball and then also football practice, right? Which we'd expect them to be. You don't want to be participating in something that's as risky as playing high school football or anything like that. But hopefully these give you a little bit of a number in terms of where CrossFit lies and just how safe it really is. So the other thing to keep in mind is there's a huge variety between how different gyms do their programming, do their training, right? So in general, CrossFit is high intensity, constantly varied functional movements. You'll see a lot of Olympic weightlifting, a lot of gymnastics movements. You'll see some running. You'll see some assault bike. There's rowing. There's some body weight exercises. There's a little bit of plyometric. They have their own exercises they've really have kind of adopted, things like thrusters and wall balls, movements you don't see too much other places. They really love burpees and box jumps, are quite commonplace in CrossFit, right? And here's the thing, there's going to be enormous variance from gym to gym and how they run things, right? So some gyms are going to have programming that's more suitable towards the beginner, right? Some are going to be more suitable to the more advanced individual. Some of the programs are going to be more competitive in nature. Some programs are going to be more focused on something like Olympic weightlifting. Some programs are going to be more focused on, let's say, aerobic capacity, running, cycling. It changes so much based on the gym. And even within gyms, they're going to have different types of classes. Some classes are going to be focused more on Olympic weightlifting, some gymnastics. Some are going to be no barbell movements I've seen, and they're focused more on getting people sweaty. Some are more on that cardio piece. Some are more focused on strength training. So it's all over the place, right? You're doing so much different activity from gym to gym, okay? The other piece that changes quite a bit is that there's going to be different levels of coaching. You have some coaches that have a ton of experience, a ton of education, are phenomenal coaches. You're also going to have coaches on the other end of the spectrum that are not so good. And I'm sure that's going to influence the rate of injury at your gym, right? Like I said, your population is going to change drastically based on who you're catering to. I mean, maybe your gym is full of competitors. Maybe your gym is full of newbies, right? Maybe your gym is full of people that are riddled with injury, and we have to be more careful about the way we program for those folks. So at the end of the day, I wish I had a better answer for you in terms of how dangerous CrossFit is. But CrossFit is exercise, right? It's like saying exercise is dangerous for you. Are there some elements of CrossFit that maybe make it a little more risky than other forms of exercise? I'm sure, but there's inherent risk to everything you do, and exercise is, definitely one of those things, right? So I think in general, it's probably pretty safe, and it's similar to other forms of exercise. And if you have your own orthopedic issues that you're dealing with, you just need to be smart and make sure you're not going in there and blowing through a bunch of pain and doing a bunch of movements that are inappropriate for you. So here are my references right here. I want to get my big head out of the way just so you can see those, right? So if you want, you can just pause the video and look at the references. If you wanted to look at any of these studies, go ahead for it. Put my head back here, and I think that's the end. So really, I just want to say thank you again. Thank you for the support. You watching this channel and supporting me, listening to this podcast, if that's what you're doing, means the world to me. It allows me to continue doing what I love, which is going to be training, helping other people train, helping other people get out of pain, and then get back to training in the gym. That's my thing. So if you're watching this on YouTube, please give this a thumbs up. Leave a comment. I'd love to know your thoughts on CrossFit, whether or not you think it's safe or dangerous, or we can make it safer, or how we make it safer. I don't know. And subscribe to the channel for updates. If you're listening to this via podcast, please consider leaving a positive rating and reviewing the podcast. It really helps a lot. And thank you very much. I'll talk to you.